Good afternoon, everyone. So today we are going to demonstrate autonomic neurofunction testing, focusing the cardiac autonomic neuropathy. So before proceeding to test cardiac autonomic neuropathy, first of all, we should have a proper history taking. And for that history taking, there is one specific form that was prepared by our department at 2017, that is Department of Clinical and Experimental Pharmacology, School of Tropical Medicine. We had prepared a history questionnaire before proceeding to the cardiac autonomic neuropathy testing. And there are some specific history like any autonomic dysfunction present or absent to that particular patient. First of all, the nasal history, like whether there is some dry nose or running nose, whether there is some sweating disturbances, history of postural fall or dizziness, any specific symptoms related to gastrointestinal tract, like alternate diarrhea and constipation, or diarrhea predominance, or constipation predominance, whether there is some abdominal discomfort or pain, whether also we sometimes need to ask about headache history, then any specific micturition disturbance history that is very related to sympathetic or parasympathetic dysfunctions, whether there is some occasional attack of bronchospasm after exercise, laughter, or emotion, whether there is some cold or hot intolerance, and then also we need to ask about the extremities, whether they are warm or cold. We need to specify those. History of erectile dysfunction is very important, and to actually explore the history of erectile dysfunction, we have one specific score, that is IIEF5 score, and according to that score also we can predict whether there is some autonomic dysfunction is present or absent. And also some general history like family history, history of alcoholism, diabetes, heart disease, obesity, smoking, and also any other general symptoms, specific drug allergy history, because during this maneuver there is a chance to have some complications to the patient's very remote chance though, but we need to be prepared. And also whether the patient is regularly having some physical exercise, whether he is athlete, because that has an impact on heart rate variability. So with that, we need to start the testing, and specifically we will demonstrate this today with one specific machine we have, that is body scan. But also we can do this type of test in our own clinic without any specific instrument, only telling patients some maneuver. We can explore whether the patient has cardiac autonomic neuropathy or not. And for that, we need to separate two groups of tests for cardiac autonomic neuropathy. First group is to test the parasympathetic nervous system dysfunction, and second group is sympathetic nervous system dysfunction. So for parasympathetic nervous system dysfunction, we have generally two options, two tests. Number one, the Valsalva maneuver. How we can do this Valsalva maneuver? We can have a BP machine, that is aneroid BP machine. If we just open that part and just give one blow to that BP machine, after squeezing the cuff, we can see how that pressure will elevate to 40 millimeter of mercury. So we have to blow with a pressure of 40 millimeter of mercury, so that the Valsalva maneuver can be done in a standardized process. So first of all, we have to tell our patient to lie down here, or they can sit we can attach the leads, ECG leads. Specifically, we need to see lead 2, long lead 2 ECG, and then when we can do this long lead 2 ECG, we first of all we tell them to take normal breathing, and we can have ECG, a baseline ECG. Then we need to tell the patient to give a blow of 40 millimeter of mercury pressure for 15 seconds. And then after 15 seconds, they will stop blowing. We need to continue that ECG for at least another 30 beats or 1 minute. So what we actually want to see there, first of all, what happened when we are giving the blow? So there will be the heart rate will increase, and therefore the RR interval will be decreased. Then gradually the RR interval becomes normalized. So there is two options. One is Valsalva ratio. What is that? In that long lead ECG, we have to find which is the shortest RR interval, and along with that, we also need to find which is the longest RR interval. Then we need to have a ratio. Longest RR interval divided by shortest RR interval. If this ratio is more than 1.2, then we can call it the report is normal. So that value is very important, 1.2. So Valsalva ratio is defined as longest RR interval divided by shortest RR interval. Next, another that is already we had mentioned, post Valsalva, we need to identify, we need to mark the 15 beats RR interval and 30 beats RR interval. That means when we stopped Valsalva, so there will be a continuous ECG is taking, the stressing is taking on, and we need to identify the post Valsalva 15th beat and 30th beat RR intervals, and then again we need to have that ratio. And if this ratio of 15th beat to 30th beat, generally what happened in the 30th beat, the RR interval becomes completely normalized. So in the 15th beat RR interval ratio, if we take it in the denominator and after we can take the 30th beat RR interval, then we will get one ratio. If this ratio is more than 1.02, then again the test is normal. So this is about the Valsalva ratio. So again, another part is that second part of the second test of parasympathetic nervous system is to have a inspiratory expiratory ratio, I/E ratio. So how we can calculate that? Again, we all know with inspiration heart rate increases, and with expiration heart rate decreases. So we can ask the patient to again lie down with lead 2 installed, and we need to take the continuous ECG. So we need to instruct our patient to take a deep inspiration for 5 seconds and then deep expiration for 5 seconds. So in this 5 seconds and 5 seconds, so total 10 seconds is one cycle. We need to repeat this cycle for 6 times. So 6 cycles will be there. The total duration will be 60 seconds, 1 minute. So 5 second inspiration, 5 second expiration. Again 5 second inspiration, 5 second expiration. So like that we need to repeat it for 6 times so that we can get a 60-second reporting. So with inspiration, what happened? The heart rate will increase. So therefore, the RR interval will be decreased. And with expiration, the heart rate will go down and the RR interval will be more. So in this case, if we take the ratio of expiratory and inspiratory RR interval ratio. So in the upper, we have expiratory RR interval, and in the lower, we will have the inspiratory RR interval. So if this ratio is more than 1.03, then we can call it as a normal report. Again, we need to understand with age, this E by I ratio changes. So there is a specific note we have in our reporting format also. What is the normal E by E ratio, E by I ratio for a specific age group? So this we need to calculate. E by I ratio, that gives us about the functional status of parasympathetic nervous system. So these two tests are generally used to detect any parasympathetic nervous system abnormality. Next part is sympathetic nervous system activity. Again, to test sympathetic nervous system, we have two tests. What is that? What are that? Number one, to check the orthostatic hypotension. So what is orthostatic hypotension? First of all, patient will lie down here. We need to check the blood pressure, and after that we ask the patient to stand up, and then for 3 minutes he will stand up. Then we need to check the blood pressure. If there is any blood pressure fall, systolic blood pressure fall over 20 millimeter of mercury, and or diastolic blood pressure fall by 10 millimeter mercury, more than 10 millimeter of mercury, then we can call it as orthostatic hypotension. So sometimes we confuse between two terms. One is postural hypotension and another is orthostatic hypotension. And we often use it interchangeably, but it should not be used interchangeably. Sorry. So we should not use it interchangeably. Yeah, sorry for the, we need to edit that. So we should not use postural hypotension and orthostatic hypotension, these two terminology interchangeably. Why? Because when we are talking about postural hypotension, that does not mean our feet should not touch the ground. So our weight should not have any confounding elements on this thing when we are talking about postural hypotension. Because if I am standing, then our muscle reflex will take care, and that will influence the blood pressure fall. So we need to acknowledge, because when we are talking about orthostatic hypotension testing, then it's okay when we are standing on the ground. But when we are talking about postural hypotension, there is some specific bed that is available by which we can tilt the patient, that is known as head up tilt table test. So if we use that head up tilt table test, so that time the feet will not touch the ground, and that time we can call it as a testing for postural hypotension. So this is very important test again to check orthostatic hypotension. Next part is the hand grip test. So in that case, we have some hand grip dynamometer. So by which we need to first of all ask our patient to exert the maximum pressure maybe it could be lying down or resting over table. They can give the maximum pressure here. Then we need to make it 30% of the maximum pressure. So 30% of the maximum pressure, we need to ask our patient to hold it like that, so that they can keep it in the pressure of 30% of the maximum maximally given pressure by the patient. So 30%, we need to remember that value, and we need to ask them to hold it for 5 minutes. So we have a data of baseline blood pressure. Then we need to check the blood pressure after holding 30% of its maximally tolerated pressure over the hand dynamometer. Then we need to check the blood pressure again. Here we need to understand the diastolic blood pressure value. If the diastolic blood pressure value is more than 16 millimeter of mercury than the baseline, then we can call it as a normal hand dynamometer testing or normal diastolic blood pressure rise. So this is the basic thing which we can do in our clinic physically. But now we will demonstrate how we can do it over the machine, and that machine is actually also give us another information regarding heart rate variability by calculating or analyzing the RR interval changes and translating it the waveform analysis, giving value on LF, HF and VLF. That means low frequency, high frequency and very low frequency values of RR interval changes. So let's start our test. Dr. Deepan, you can come and demonstrate. So we have Dr. Deepan Shah who will demonstrate this machine and then we can proceed for the testing.
Okay, we have with us our volunteer, Dr. Jyotirmoy sir. We have any history, any prior surgery or anything like that? PCA, cardiac history, nothing. You have no case of hypertension or any other comorbidities as such? Okay, then I will do this speech over here. And lie down completely in supine position and take off load. Soft. Yeah.
So Dr. Deepan, please let us know about what are the questions you will ask before proceeding to the cardiac autonomic neuropathy testing. What are the typical contraindication you will check?
So obviously, the patient is having some history of MI or any ischemic heart disease, known as ischemic heart disease, or known case of uncontrolled hypertension, and some ECG abnormalities, or as you said, mutilation problems and all.
Also, we need to ask about some history on intracranial hemorrhage,
yeah, sure.
or say any contraindication to Valsalva maneuver. We need to first explore.
Yeah,
we need to ask our patient.
If the patient have any history of vitreous hemorrhage or anything like that.
Yes. Yes. Any contraindication to specific procedures like Valsalva, we need to ask, and because that is one thing which often we need to require attention. Specifically, what is important regarding Valsalva, because when we are having the Valsalva maneuver, it may produce some heart block like element. See, bradycardia will be more and we will get a heart block like thing. So we need to explore that too, whether there is some history of heart block or not. And we should have a proper emergency tray like we have in this lab too. We have different emergency medications where we need to use it in case of any emergency.
You have to prepare for the
So this is the basic thing before we need to start the proceeding. And another thing is important while we are telling our patient to lie down, whether the patient has should not smoke at least 3 to 4 hours before the proceeding, and also the bladder and bowel should not be cleared or not. That has been cleared or not. That needs to be asked.
Yeah, patient shouldn't take any kind of thing like caffeine.
Like caffeine containing things that we need to. Let's start. So all the leads are placed.
Just trying to log in into the software.
So there is one software. So we need to first of all log in that software because this is the mechanism.
So we have got the continuous ECG testing with us, and now we'll ask the patient to be on the point position and take the normal resting ECG.
So we are going to take the normal resting ECG first. You take normal inspiration and expiration. So as we are privileged to have Dr. Jyotirmoy with us. So sometimes we are using the medical terminologies, but it is better to use the layman languages when we are doing this type of test. So instead of inhalation or exhalation, we need to tell breathe in and breathe out. Yeah, that is sometimes happens. Mobiles and every metallic thing we need to remove before the testing, so that we should
After taking
remember.
ECG for 1 minute, we will record it. We will save it, the result.
So after having that 1 minute ECG, we need to record that and we need to save that. Because why this is important, why we will analyze the report, then we will find there is one place, and already we had discussed that VLF, HF and LF value. So actually the RR interval changes, that is translated into the language of waves, and that is the very low frequency wave, and HF, that is high frequency wave. So what is high frequency wave? Generally, high frequency waves are demonstrating the parasympathetic nervous system function, and when we are talking about HF are the parasympathetic nervous system functions. Now coming to the LF includes both sympathetic and parasympathetic nervous system activity. So when we are taking LF by HF ratio, if the LF by HF ratio is going down, that means there is some problem in case of sympathetic nervous system activity. So HF is more here. And when it is vice versa, that means the HF value is low or the LF by HF value becomes more. So that could be some problem in parasympathetic nervous system activity. Let's proceed for the next.
Okay, now we'll ask the patient to be in supine position and we'll ask him to inhale slowly. And we have two lights set, green light and red light. The machine will dictate that. So we will ask the patient to inhale slowly till the green light gets off, and exhale slowly till the red light is off. It will be done alternatively for 6 times. And meanwhile, we will also record the ECG while taking deep breathing, inhalation, and also breathing exhalation. We will take the ECG.
As we had mentioned previously, what is the methods of inspiratory expiratory ratio testing while doing ECG? That means we need to ask patients for inhalation for 5 seconds, then 5 second exhalation, and we need to record that RR interval. So we all know that with inspiration heart rate rises, with exhalation the heart rate decreased. So with inhalation, what happened? The heart rate increase means RR interval will be reduced, and with expiration the heart rate will be decreased, but RR interval will be more. So we need to calculate the expiratory RR interval divided by inspiratory RR interval, and we need to check what is the ratio. If the ratio is more than 1.03, then we can confirm that the patient is having normal parasympathetic nervous system function. Again, that has some age specific values that we already discussed. So let's start the test. We need to repeat that expiration inspiration cycle for 6 times. So 6 times means 5 minutes in 5 second inspiration, 5 seconds expiration, like that. So 10 seconds means 1 cycle. We need to do it for 6 cycles. So that means 60 seconds, 1 minute. So let's start.
Sasna.
Shashna, Shashna. হয়নি আবার আরেকবার কর রিল্যাক্স
নিঃশ্বাস নিতে থাকো নিতে থাকো নিতে থাকো নিতে থাকো ছাড়ো আস্তে আস্তে ছাড়তে থাকো ছাড়তে থাকো ছাড়তে থাকো ছাড়তে থাকো না নিতে থাকো নিতে থাকো নিতে থাকো ছাড়ো না ছাড়ো now ছাড়ো now ছাড়ো
So we need to ask the patient little bit more actively, like আমি যখন বলতে থাকবো আপনি শ্বাস নেবেন 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 এরকম করে নিতে থাকবেন, আবার যখন আপনি বলবো যে শ্বাস ছাড়ুন তখন শ্বাস ছাড়বেন, শ্বাস ছাড়তে থাকবেন, ঠিক আছে? যত দেখুন আমি কিরকম ভাবে শ্বাস নিচ্ছি। এটা কিন্তু আপনাকে যতক্ষণ আমি বলবো যে শ্বাস নিতে থাকুন শ্বাস নিতে থাকুন শ্বাস নিতে থাকুন পুরোটাই শ্বাস নেবেন, তার মাঝখানে শ্বাস ছাড়বেন না। যখন আমি বলবো এবার শ্বাস ছাড়তে থাকুন তখন শ্বাস ছাড়া শুরু করবেন, এবং যতক্ষণ বলবো আপনি শ্বাস ছেড়ে যান ছাড়তে থাকুন। আরেকবার রিপিট করো। হয়েছে? ঠিক আছে।
Now we will take ECG. At first, we record ECG while the patient is on spine position, and we will take ECG after immediate standing.
So let's start. What is the change in the heart rate variability while standing? That this test will let us know.
At first, we are recording spine position ECG.
So we are now recording ECG in supine position. So this will take total 1 minute. Then we will ask, বলে দাও এখন থেকে বলে দাও যে যখন
কিছুক্ষণ পরে আমরা বলবো উঠে দাঁড়াবো, ঠিক আছে?
তখন সঙ্গে সঙ্গে উঠে দাঁড়াবো। So you have to tell now 1 2
এবার দাঁড়াও আস্তে আস্তে।
এবার দাঁড়াও। We need to ask them to stand up quickly. So there is some issue, the lead is off, okay, no problem. Will let us. So let's please again lie down so that you need to repeat stand up, because otherwise okay.
Now please stand up.
No, এখন না, একটু আগে lie down হও। Okay, resting. So sometimes we need to volunteer because of these leads could be displaced. No problem. No problem. ঠিক আছে, তুমি এখানে রেডি করছো? রেডি?
তারপরে
Please stand. Yeah.
Record coach, you just tell me.
Follow.
So recording ECG when the patient is standing.
So in the standing position, we need to record the ECG. So this will be again for total 60 seconds. So we need to ask the patient to stand up for 60 seconds. Okay, so we have done it. So please be seated.
Now we'll go for Valsalva maneuver.
So next is the Valsalva maneuver. And for Valsalva maneuver, it is better to ask patient in the sitting position so that they can blow it properly. And ideally, when we are doing Valsalva maneuver, there are some machines also that also included that thing, that when we are doing Valsalva maneuver, we need to use one clip to block the nose. So there should not be any leakage from the nasal sides. So let's first explain here.
এই পাইপটা মুখে দিতে হবে, ঠিক আছে? মুখে নিয়ে
Little louder. Yeah.
মুখে নিয়ে এই হাতটা মুখের সাথে ক্লোজ রাখো, এই হাতটা চেপে এই হাত দিয়ে, কারণ হাওয়া বাইরে বেরিয়ে না যায়। যখন আমি বলবো ফু দিতে, তখন জোরে ফু দিতে হবে, হাওয়া যেন বাইরে লিক না করে, এবং এখানে 40 মিলিমিটার অফ মার্কারি প্রেসার তুলতে হবে মিনিমাম, ঠিক আছে? তুলে ধরে রাখতে হবে কনস্ট্যান্ট, হাওয়া ছাড়লে হবে।
So you can show that thing, please. Yeah. So there is one in that the patient can see whether he is blowing at 40 millimeter of mercury or not. Ideally, your nose should be blocked using some clips, but we don't have that clip, so you should not block that. You leave it. You leave it. No problem. So like this, we are doing this test. Let's see. Okay. So you will instruct. Then you will start doing.
যখন এখানে সবুজ আলোটা জ্বলবে, তখন ফু দেওয়া শুরু করতে হবে। এখানে প্রেসার বাড়তে 40 হবে, ঠিক করে তুমি দিতে পারলে 40 হলে পরে এটা কিন্তু ওই প্রেসারটা ধরে রাখো, হাওয়া ছাড়লে হবে, তখন আমি বলবো তখন ও ছাড়তে তখন আস্তে আস্তে ছেড়ে দেবে। ফু দাও। ধরে রাখো, ধরে রাখো। হ্যাঁ।
So for 15 seconds.
ছাড়ো।
So for 15 seconds, it is very important. We need to ask our patient to blow it at the 40 millimeter of mercury pressure for 15 seconds. So this timing is very again important. We need to remember two things here: 40 millimeter of mercury pressure for 15 seconds. Then also followed by that, the ECG should be done continuously, because also we need to check the 15th beat post Valsalva, 15th beat RR interval and 30th beat RR interval to get that ratio. Also, what is Valsalva ratio? Valsalva ratio means during Valsalva, what happened? As the heart rate increases, the RR interval will be going down. So we need to take the minimum RR interval from there, that duration, that 15-second duration, and also we need to get the maximum RR interval thing, so that we can calculate the ratio of maximum RR interval and minimum RR interval, and that ratio should be more than 1.2.
So now we will move on to the sympathetic part, which has got postural hypotension checking part, and after that we will go to the sustained handling test.
So already we had completed the parasympathetic nervous system panel, Valsalva ratio, and the inspiratory expiratory ratio. Now we have to move to the sympathetic nervous system part, and to check sympathetic nervous system, we need to check the, here we should mention the orthostatic hypotension is there or not, and also we need to check the isometric hand grip test exercise, diastolic blood pressure change report. So let's see.
So we'll start with the orthostatic hypotension part.
First of all, we need to you need to lie down. Yeah. So we will start the test after a few seconds. After the patient becomes a little bit stable.
And at first we will record the blood pressure when the patient is on supine position. After that, we will ask the patient to stand immediately. We will record blood pressure once again. And patient will remain standing for 1 minute. After 1 minute, the machine will automatically record the blood pressure once again.
So
we have 3 readings.
So here 3 minutes record is not there. So that is one deficiency in this particular machine. The 3 minute post standing 3 minute report is not there, and we all know by definition when we are talking about orthostatic hypotension, we need to check post standing 3 minutes, post 3 minutes after standing. So that report we can do manually. Okay, so let's start. So first we are checking the blood pressure in the supine position. Supine position, we are checking the blood pressure. There are some machines that there are some head-up tiltable are available which can move automatically. And
now we should ask the subject to stand, and after standing immediately we start recording the blood pressure, and please help him with this.
Yeah. Please stand.
Ask him to be relaxed.
Relax. Okay.
We are recording. Just
Wait. No issue. That will be a that pressure, no problem. এখন আর ডিটেইল ক্লাস চাই কথা আছে।
Yes, the further reading, ask the patient to be standing for 1 minute. After 1 minute, the machine will start taking the reading automatically.
So patient will remain standing. So there is some lacuna here. Actually, we want some machine which can have the blood pressure reading immediately, because as you are standing, we need to know the blood pressure immediate after standing. But for that, we need some non-invasive blood pressure monitoring, which could give us immediate report. But this type of machine devoid of that facility. Okay, so for all practical purpose here, we need to actually depend on the orthostatic hypotension cutoffs, like lying down blood pressure, and then post 3 minutes after standing, we need to check the blood pressure again to see the blood pressure drops, and then we can comment on orthostatic hypotension is there or not. So now again, your blood pressure is going to be start. This is post 1 minute.
So you have got all the readings, 3 readings, and we are going to save the data.
So already the orthostatic hypotension is there or not, we had checked. Now the next part, and that is the hand grip test. So this is the hand grip, please demonstrate.
You have to ask the patient to hold it by his non-dominant hand. So I think you are a right hander, so you'll be holding this with your left hand. And we will ask the patient to hold this as tightly as possible. Okay. And after that, we will record the BP. And before that also, before starting the hand grip test, we record the BP, normal blood pressure while patient is in sitting position. Then after pressing the bar, we will record the BP once again.
Yeah. Here need to be little bit correction. According to this machine, we are doing this, but actually when we are having that sustained hand grip test, we need to ask our patient to give the maximal pressure, maximum isometric exercise pressure, and after that we need to calculate the 30% of that, and we need to ask the patient to hold in that 30% of maximal giving pressure for at least 3 to 5 minutes. So many patients will be tired, the muscle will be fatigued, then we can ask them to stop. But after that 3-minute holding of hand grip for at 30% of maximally producing pressure, 30% of the maximum value of that particular pressure, we can calculate the change in the diastolic blood pressure. If the diastolic blood pressure rises more than 60, then it's normal. So let's start. Let's do this test. According to this machine, we need to be little bit modify that protocol, and actually what we are referring to, that is known as Ewing's protocol. So we generally internationally, all the societies and all the physicians actually prefer this Ewing's protocol, but here we need to little bit modify it, and we are using some modified version of that Ewing protocol to get the reports. So let's start.
Also, while placing the bar, we have to put this arm, we have to give some support underneath the arm.
Yeah,
It's very important.
that is very important. Otherwise, the muscle fatigue will be more, and that could be enhanced if the hand does not get any support. So we should have a proper support. This is little bit unphysiological we have, but okay, we can do that.
Yeah, first we are going to
No, otherwise, what we can ask the patient, if they can lying down position also, they can squeeze. The only thing is that the hand should be in the resting position. This position is little bit difficult. So you can come, and if you can sit here. No, it is. You can sit here. Yes. Yes, and you can keep it in the resting position. The elbow should be rested properly. Yeah.
Before beginning the hand grip test, we record the BP, the normal blood pressure at first.
So baseline, we are having the baseline value now. And also it is very important to have the position of the blood pressure arm, also measuring arm, that should be also, the elbow should be there, and he is straight. He should be straight, and backrest is little bit controversial whether the backrest has actually any effect on the blood pressure or not. But at least this elbow should be rested properly. That is important. So we can have
Now, we will ask the patient to be in position and hold the bar in one hand. That's the end position.
Should I start?
No. When I will say, I will ask you to place this bar, this red one, as tightly as possible
For
And-
how long?
for 15 seconds. Until you record.
So here little bit modification, what actually we should do in the hand we test now hold. So here we are asking patients to hold it maximally, but ideally it should be done like that. We need to ask the patient to hold it for at 30% of his maximally tolerated pressure for at least 3 to 5 minutes. And we need to check the blood pressure value, specifically the diastolic blood pressure value, and how it changes from the baseline we need to calculate. But here in this particular machine, the standardization is done little bit in a separate way.
Yeah. So done. Relax.
So okay, it was done, and we need to proceed for the and here what happened, the diastolic blood pressure initially it was 77 millimeter of mercury, and post handling it was 103 millimeter of mercury. So there is a rise of almost 26 millimeter of mercury. So that is clearly more than 16 millimeter of mercury. So Dada's diastolic blood pressure rise optimally. So he has a good sympathetic nervous system function. So let's start for the final test. Okay. So if Dada, please come, and you have to lie down here.
So this after this.
So you have to be in rest position, isn't it? Let's
Now, we will ask the patient to be in supine position and should be relaxed and should not make any kind of body movements for 5 minutes. And the machine will record ECG for 5 minutes and will check for heart rate variability.
So actually we are doing here the ECG for at least 5 minutes, and 5 minutes means we need to check the heart rate variability. Here by this heart rate variability testing we will get a knowledge regarding 3 parameters: LF, HF and VLF. So actually the machine is going to translate the RR interval into the frequency domain analysis, and by which we will get the values of LF, VLF and HF. And as the HF means, if the HF determines the parasympathetic nervous system function, and the LF by HF tell us about the sympathetic nervous system function, we need to see the results to analyze whether the patient has sympathetic or parasympathetic nervous system dysfunctions. So let's see after what happened in this 5 minutes ECG. So these are the protocol we need to follow when we are doing the cardiac autonomic neuropathy testing. So another 30 seconds left. So why actually we are doing cardiac autonomic neuropathy testing? Because if there is cardiac autonomic neuropathy present in our diabetic patient, that will lead to increased risk of sudden cardiac death, nighttime death. That also has some implications like that. If I have cardiac autonomic neuropathy and I am taking some drugs which can prolong QTC. So in presence of cardiac autonomic neuropathy, it may happen that our we will be land up into more chance of we will have a more chance to get torsalis. So this is why it is very important test, and already the test was completed. Let's see the results. We'll just check the results now. Yes. So hopefully you can see the results here. So let's check. So in the lab, in your computer, you will find the autonomic neuropathy results in a PDF format.
Yes.
Okay, so you can see the first of all the resting heart rate. Then what is the response to the deep breathing? And here we will find that the expiration inspiration ratio, which is 1.15, as per his age, it is we can denote it as a borderline thing. So there could be a borderline parasympathetic autonomic neurofunction deficit, but again we must appreciate maybe due to some technical issues and specifically the taking breathing without timing changes that may cause some errors. So what is the again the standing response? That is again normal. Here we can see the standing ratio 30:15, and also we'll find the Valsalva maneuver, the Valsalva ratio, which is 1.74. Again, it is more than 1.2, so that is normal. Now moving to the sympathetic nervous system function testing. Again, the orthostatic hypotension is there or not, that we can found. In the supine position, it was 132/82, but standing after 60 seconds, it becomes 122/85. So there is no orthostatic hypotension, but it is better again to note that after 3 minutes we should check the blood pressure, so get the actual knowledge on orthostatic hypotension. And for sustained hand grip test, we found, so what happened, the diastolic blood pressure rise was 26 millimeter of mercury, which is more than 16, so like that. So here the machine is interpreting like mild parasympathetic dysfunction, but as we had already mentioned, maybe due to that timing, the breathing in and breathe out time differences, we need to interpret it after proper clinical correlation. Now coming to this RR interval tachogram, this is a complicated area where we need to apply much more things on physics and some core physiology and mathematics. So here what we want to appreciate that the LFHF ratio, which is little bit in the lower side, but not that much lower compared to the normal one. So here you can see the LF value. These are the logarithmic scale. So what they are maintaining, the sympathetic nervous system and parasympathetic nervous system function, sympathetic nervous system function is little bit more compared to the parasympathetic nervous system function. But again, this need to be interpreted with some caution. So these are the other reports. So this is by which we can test autonomic neurofunction. And again, there is some form by which you can see this is the autonomic function details. We can put it in this by after having the reports manually collected. We can also get results like that. And already we had discussed how to detect autonomic neuropathy clinically, and specifically the cardiac autonomic neuropathy, by using simple tests like deep breathing test, by calculating the expiratory inspiratory ratio, followed by the Valsalva maneuver, then the sympathetic nervous system testing with isometric exercise, that is hand grip test, to check the rise in the diastolic blood pressure, and finally whether there is some orthostatic hypotension there or not, that we can detect. So thank you all. Thank you.